This broadcast is brought to you by Colby Brooks with Century 21 Right Pace Real Estate and buyfrombrooks.com. Let Colby Brooks handle all of your real estate needs. The latest numbers released by the Arkansas Department of Health show Craighead County at 36 COVID-19 positive cases, at Arkansas over 1,400. We're talking about that next on NEA Report.
Stan Morris reporting.
New numbers released today by the Arkansas Department of Health and the Arkansas governor show that Arkansas is now over 1,400 confirmed positive cases of COVID-19. Thanks for joining us. Stan Morris reporting in Jonesboro. It's April 13th, 2020. It's the day after Easter and a weekend where we hoped that the numbers had continued to trend downward. If you look at some of the data that we've been including on our website, some of the positive cases by day have gone down. In fact, on Saturday, they were as low as 26. 52 on Sunday, and today over 100 new cases. It's the largest single day increase yet for Arkansas. We have not peaked yet, and we were hoping to see a sign of that, right? We're looking for signs of hope, and we're going to bring those to you when we can find them. But that being said, we're also going to tell you when the hope is perhaps something that's falsely found. Confirmed in Arkansas, over 1,400. That was the word from the Arkansas governor. Deaths are now up to 30. This is 130 new cases from the day before, but there may be a particular reason why this is happening. According to the Arkansas governor, many of the new cases today came from a single barracks at Cummins Unit. We're talking about the prison, right? Where the Arkansas Department of Correction reports that 43 inmates at Cummins Unit tested positive for COVID-19 in a single barracks. That barracks only has 46 people. That's how contagious this thing is. That's why the shelter-in-place order exists. That's why social distancing is happening. You had 46 people in a single confined space, and 43 out of 46 now have this. And the other 3 probably are being watched closely. It started on Saturday when an inmate was sent to a hospital diagnosed with the coronavirus there. You got to think he was pretty bad to go from a prison to a hospital. It's not like they're exactly treating people like they're at a resort there. Prison officials then tested everyone else that lived in the barracks and staff that had come into contact too. Now, as of Friday, which of course was before that, 13 employees of the Arkansas Department of Correction had tested positive and were under quarantine. Of course, now we don't know what that number might be. It may have been changed, but all inmates and staff at Cummins have been given masks before the first positive tests, the Department of Corrections reports. Still not enough to prevent 43 from being tested positive for COVID-19 in Cummins Unit. Now, that may account for a significant portion of the jump from the day before, but we're still looking at being around 70 to 80 new cases from the day before. That's a significant number when you take a look at this graph that's been being prepared daily by Dr. Pat Carroll in Pocahontas. You can see on this, it's very simple. We tried to make it to where everybody can understand not only how many new cases are being tested positive each day, how many new positive tests come in each day, but also how many total tests are being performed. That's an important number because if they perform less tests than the day before and the numbers don't go up as much, it doesn't mean anything. If the same number of tests are being performed every day and the number's slow, then it means something. And so you can see, based on the numbers we've been tracking, that number had dropped down to about the 50 mark for a few days here. It peaked last week a little bit around 80, but today, after it's over with, when Dr. Carroll updates this graph later tonight, it's going to be at the top, it's going to be at the highest it's been yet, with 130 new cases today. Even if that was perhaps skewed by the prison numbers, that's still a very big daily increase here in Arkansas. So we appreciate Dr. Carroll for helping us with that. We're also tracking how many active cumulative cases there are. Active cases and cumulative cases, right? Because the number for cumulative is always going to go up. That's always going up. Today, over 1,400. That's where the blue line would be if it's extended out to the 13th. Well, this other number, the peach-colored number, I can't really even tell what color that is, but it's the number of people that have the coronavirus that have not recovered or expired. And that number is right under 1,000 today, an increase of about 110, about 100 really. And so that number is one that we see could potentially go down at some point. cumulative cases number will never go down, but the active cases number will at some point, we hope. And that's the number that we're going to make sure we keep reporting to you. Now, NEA counties by the numbers in Northeast Arkansas, there have been some changes. In fact, this that I'm showing you right now on the screen has been updated, but not yet by the Arkansas Department of Health on their map. But we did learn, the reason I say that's because the governor informed us that Jackson County has their first positive case. So if you see this, you see 0 positive in Jackson. Actually, we learned otherwise today. The first positive case in Jackson County confirmed today. The latest numbers show the layout looking a little bit like this. Craighead County up to 32 positive, according to the Arkansas Department of Health's latest numbers that have been released. Moving through Northeast Arkansas, Randolph at 8, Clay at 1, Cleburne County up to 70, right? Significant number there. Crittenden 101 positive. Fulton still at 0, barely any tests. Greene County 6 positive, 3 recoveries though. A lot of negative tests there. Independence 5 positive, 4 recoveries. Lawrence 11 positive, 0 recoveries, and according to this, 1 death. That being on the Arkansas Department of Health's website. Several other counties there as well. If you want to find yours, we've linked it up at neareport.com, so you can go there, check it out. I mentioned this because, yeah, this is a tough one to keep up with, and it's being updated multiple times throughout the day, right? So our numbers are updated based on theirs, but if you want to see what their latest numbers are, this link right here is going to be where you want to go. Now, we've talked about the numbers, of course, for the United States, as we've continued our broadcast here throughout the weeks on NEA Report. So I want to give you the latest numbers related to where we're at across the U.S. and across the globe. In the United States, we continue to see more testing than any other area of the world. That's why our numbers are at 568,176 as of this report, according to Johns Hopkins. The number of deaths in the United States is a number that's tragically going up too. We're looking at 22,935 having died so far. In the world total, 1,897,373 confirmed cases with 118,304 deaths. In the United States, I want to go back to that number for a second because we actually have a new number available. We talked about that, 568,000 confirmed cases in the U.S. There have been 2.8 million tests performed in the United States so far. Quite a few tests when you take a look at some of the other countries. China's now at 83,000 cases. We've told you they're not moving. We don't know the reliability of the other numbers of other countries. At one point, Russia had 2 cases. Let me look and see where they're at right now. It's probably not 2, right? That wouldn't make much sense. Yeah, they're obviously up to 18,000 now. But you're seeing a lot of countries reporting numbers that there's no way to really be vetted. So if a country is maybe not as thorough, or maybe even has a government like China that doesn't want to have the truth necessarily out there because it doesn't look so good, well, then we're kind of going based off of their honesty. And sometimes that's going to make us look worse because, of course, the United States is, at least we should be, reporting mostly truthful, accurate numbers, 568,000 so far. But a lot of people still are unable to get tests, including in Northeast Arkansas. There was one young lady that specifically, the sister of a good friend of mine, who is not able to get a test, who's at home quarantined for 7 days with symptoms, but because of the way that the system is working, and unfortunately not working in her case, she can't get a test to find out if she actually has it. It's scary for a lot of people, right? It is. But we're trying to find hope in the numbers while also being realistic about what we're seeing. In this instance, in today's instance, there's going to be over 900 active cases still, and we're also seeing the largest single-day increase that we've seen yet in Arkansas. But that being the case, we have seen numbers today that swelled up out of the Cummins Unit, with 43 at least out of one specific barracks. So we hope that perhaps that means that the numbers didn't increase as much as it would appear. But even with those numbers, Arkansas, even if you took out the Cummins Unit numbers, we would still be looking at one of the largest single-day increases of new cases. And that probably it may have something to do with the fact that the Easter weekend was this weekend and things went a little bit slower. Arkansas's not hit its peak yet, according to the governor, who says that we need to continue these measures and continue social distancing and don't let up yet, despite what some are saying nationwide. Of course, that's coming from the governor, one of only a handful in the entire state that has refused a shelter-in-place order. So it's significant of him saying that we have to continue these. But as we mentioned, the number as Arkansas sees continue to grow is one that we're going to be following in multiple ways, so it's not just the cumulative. The World Health Organization is investigating reports of recovered patients who tested positive again. They're trying to make sense of why this happened. Some reports of COVID-19 patients testing positive after initially testing negative while being evaluated for medical discharge in South Korea. They made it through the virus and they were being tested to be let go, and then they tested positive again. They're trying to figure out why, right? Because we've heard news of this, and if people can get it again, that's a big question. We don't know the answer to that. Well, a large-scale antibody testing survey is being performed in Los Angeles County. Of course, we're talking about California, as the old governor would say. The larger population of that county is about 10 million or more. That's more than 40 states, right? It's bigger than most of us have ever been in a single county. So they have a lot more people there to consider when it comes to COVID-19. And what they're trying to do is provide testing to find out if people not at risk, not showing symptoms, also have this, and if so, what their antibodies look like. It's a hope to get an idea of how contagious this thing really is, not just to the people showing symptoms, right? Because if all we test are the symptomatic, and we look at the death rate there, then of course it's going to be worse because we're testing the people that have this thing worse than anybody. That being said, we need to find out what is the mortality rate whenever it's something considered for the totality of everyone that has it, not just the people that have symptoms that have been tested positive or have severe symptoms even, because not everybody with symptoms can even get a test. So that suggests the mortality rate is one that's still yet not been accurately measured. Well, a press release from New York Institute of Technology College of Osteopathic Medicine, wow, I barely got that out, says that fever is the most common distinguisher between COVID-19 and seasonal allergies. Seasonal allergies being something that your friendly neighborhood news reporter here suffers from very commonly. You probably heard it on the broadcast before. Well, as spring reaches full bloom in the south, the beauty of budding plants also brings the yellowish powder that covers our cars and irritates our allergies and our friendly neighborhood news reporters too. Didn't say that, but I added it. Weather.com's allergy tracker ranks pollen counts as high to very high throughout Arkansas right now. So a lot of folks are going to see sinuses kick up into another level, respiratory distress and issues like that. It doesn't always mean you got COVID-19, right? So this is a pretty helpful article that we've linked the actual press release here at neareport.com. It's talking about how that typical irritations have many people concerned their body's reacting to COVID-19, but Dr. Shane Spites, our friend, says that people that experience sinus irritation each spring shouldn't be alarmed. I love the quote here, by the way. If it walks like a duck, quacks like a duck, it's probably a duck. Right. It's probably not COVID-19, in other words. One of the most common symptoms of COVID is a high fever. Spites said that's not consistent with allergic reactions to pollen. Muscle aches, fatigue, shortness of breath are common to COVID, but not the common cold. So if your muscles are aching, if you're sore as heck, and if you've got a nasty fever, that's not allergies. You shouldn't be running a fever with your allergies, right? You shouldn't have muscle aches with your allergies. That's either the flu or that's something else. And that means it's probably time to take it a little more seriously. Additionally, COVID-19 patients usually experience a dry cough instead of the wet cough that comes with congestion brought on by allergies. I don't want to do the imitation, but I hope everybody knows what the difference is between a wet cough and a dry cough. Sinus infections can bring on a fever requiring medical attention at some point if you have an infection from the sinuses. But people should treat their allergies with antihistamines and over-the-counter medications as they normally would, according to the doctor. Again, neareport.com if you'd like to see more on that. Well, just catching you up to date, the big headline today is Arkansas is over 1,400 COVID-19 cases, up to 30 deaths, now confirmed in Jackson County. 130 new cases from the day before, with a large outbreak happening at the Cummins Unit, the prison, the Arkansas Department of Correction. 43 inmates at least have tested positive for the coronavirus, and several employees there have tested positive too. 46 people in the barracks, by the way, 43 of the 46 testing positive. And now you're up to date from NEA Report. Thanks for tuning in today to our broadcast. And if you think we did a decent enough okay job, we hope you'll consider liking, sharing, or even subscribing. I'm Stan Morris. Hey, become a supporter too. Don't forget about that. 99 cents. Cool stuff there. Stan Morris reporting, and you're up to date from NEA Report. Have a good one.